Okay guys, it's Amber and I am back for a little update here. I am 22 weeks pregnant and I just wanted to update you guys on what has happened this weekend and how my pregnancy has gone from low risk to high risk. Stay tuned for the story. Okay, so in some of my other videos I had mentioned that I thought I was having a pinched nerve in my neck or maybe a herniated disc, and I had numbness on the right side of my body, and my left arm I wasn't able to lift, and I had weakness in my left arm. So that's kind of what we were going with, that it was just a herniated disc or a pinched nerve. I had went to my midwife, I had been to my chiropractor, and that's just kind of what we were deciding what it was, or that it was. So this weekend, my chiropractor called, and she just was a little concerned with the progression of when the injury started and how the numbness and weakness had kind of progressed throughout a week. So she decided that we should go to the emergency room. First of all, she wanted to call my midwife, so she called my midwife for me, and then they kind of all decided that I should go to the emergency room and get some imaging done. So Saturday, we went to a bigger hospital about an hour and a half away, and got admitted to the emergency room around 5 o'clock. I had an MRI done, and they found a lesion on my spine. So we were kind of freaking out a little bit. I have a history of Hodgkin's lymphoma, and so they were concerned that possibly the lymphoma was back, or that it was a tumor, or something like that. So when we were at that ER, the ER doctor there, basically, I didn't care for her, and she said that it was pretty much my lymphoma had come back. So of course we were freaking out. I was just really scared, thought that my cancer was back, I'm pregnant. It took us 5 years to get pregnant, and I just thought, why the heck is this happening now, after we've tried for so long to have a baby. So anyway, they decided at that hospital that they weren't equipped to deal with this kind of problem, so they were going to ship me off to a bigger hospital. So they got me a transfer. I don't know, it took forever. We got there at 5 o'clock that night, and we did not get transferred until 2 a.m., I think. So I hadn't had anything to eat or drink since noon on Saturday when we ate lunch. So I should have definitely eaten or drank something before we left for the ER. So anyway, we got transferred, and I got to the bigger hospital, and the neuro team came in, and an OB came in, and all these people came in and checked everything. Baby was okay. They just needed to try to assess me and see what was going on. So after being seen by the neuro team, they decided they were going to admit me to the hospital. So I finally got a room like around 6 a.m. in the hospital, and the neuro team came in that morning and decided that really quit it. So the neuro team came in that morning and decided that they were going to do another MRI. So my first MRI they did was 35 minutes. It wasn't that bad. The lady who did it, she was kind of prompting me and telling me, okay, you've got 5 minutes for this one. You've got, 10 minutes left for that. You've got 15 minutes left total. Let me let this giant dog outside so he leaves us alone. Hang on one second. Sorry about that. Had to get rid of my giant dog. Anyway, so the first MRI I had was 35 minutes. It was okay. And then the next day, after seeing the neuro team, they thought that he didn't think that it was cancer, that it was Hodgkin's lymphoma. I'm out of breath. He didn't think it was cancer, but he just didn't know. And they wanted to do an MRI with contrast, and there's some controversy over doing that. And in the end, the hospital, the radiology people said, no, absolutely not. She's pregnant. We're not going to do contrast. So that was kind of out of the question. But with the contrast, they would have been able to see what was going on in my spine a little bit better. So they ended up not doing the contrast, but they wanted to do another MRI of my brain, my whole spine all the way down to the lower back. So they ended up scheduling that. So I don't even know my days anymore. I think it was Sunday night. I went in for that MRI, and we just kind of waited all day. At this point, the neuro team thought that it was either a benign tumor, possibly could be a malignant tumor, or it was a vascular issue, and but he did not think that it was the Hodgkin's lymphoma. So praise the Lord. I was happy to hear that, but we still had no answers. So anyway, I went in for my second MRI, and holy hell, that freaking sucked. It was an hour and 45 minutes long, and the first one I thought, oh, I don't know why people freak out in these, because it's not that bad. Well, this one I was about ready to freak out at the end. And I got super hot while I was in there. My face was beat red when I got done, and I was just about in tears when I came out. Just because I just couldn't hold still. I was praying the whole time that everything was okay, and that they wouldn't find any more lesions, and I was just worried. And then the whole time, the baby was kicking me, going crazy because it's so loud in there. So it was just very stressful. So I had that MRI, like, I got done like at 6, back up to my room, and my mom and some family were up there hanging out with my husband. So I had some company, and then we didn't hear anything from that MRI until it was like 26 hours later. So the next day, we finally heard about that MRI. In between, they had sent me for an echo because of the chemo I had. Could have some heart effects. So I had an echo done. I still have to do a pulmonary function test. And they wanted to do a couple other things, the OB people. And I also had an anatomy scan, which I wasn't going to do any ultrasounds at all. And like within 24 hours, I had like 4 ultrasounds. So there goes that plan. But anyway, the anatomy scan was good. Everything is great with baby, measuring perfect on time. Everything's fine. So so that was also good news. We're not finding out the gender, but I had a moment of weakness, and I thought, oh, I'll have the ultrasound lady put it on a piece of paper, and then later on, like if I have to deliver early, I mean, there were so many unknowns. I thought later on, if we want to know, we can find out. Well, the baby wasn't having it. Didn't show the goods. So I'm glad we didn't find out, because I still don't want to know until we have the baby. So anyway, they finally came in. Neuro never came in, but they talked to the OB, and she came in, and basically what is in my spine is called a cavernoma, and it is an after effect of the radiation that I had when I had cancer. I had cancer when I was 24, and I had a year or 11 months of chemo and 1 month of radiation. So anyway, it's basically, from what I understand, which I didn't really get to talk to the neuro team, is that it is a mass of blood vessels, and it started bleeding into my spinal cord. And so whenever it started bleeding, it expanded and caused swelling, and then that swelling caused the arm pain, the nerve problems, those kind of things to happen. So they don't think it's actively bleeding, because my symptoms stopped. Like they got to a certain, like my arm got numb to a certain point, and then it didn't get any number or any more numb. I don't know what word to use there. But anyway, the symptoms did not progress any further. So so they're thinking that it has stopped bleeding, and then as my body just has to absorb that blood in my spinal cord, and as my body absorbs that, then I will get some of my movement back, and my numbness should go away, and all that. So long story short, I have a spot in my spine that started bleeding, caused all these weird symptoms, and so now I cannot deliver at my birth center, which I'm bummed out about, and I'm not going to be able to have my water birth, and all these things have changed, and I am being transferred to a high-risk team. I have to meet with the neurosurgeons in 8 weeks, kind of get a game plan, but they've kind of already said that I may not even be able to have a vaginal delivery, because the cervical spine fluid is already increased, and then the pressure from pushing could cause the symptoms to happen while I'm in labor, and could lead to paralysis and different kinds of things, from what I've read. But like I said, I haven't talked to anybody yet. So I really don't know what's happening yet. I have to meet with the high-risk team in 2 weeks, And then right now I'm trying to see if possibly the doctor that works with my midwives, if maybe that OB and the high risk team can collaborate, and I could possibly have a semi-natural-ish birth. But I mean, if they say no, you have to have a C-section, then I have to have a C-section. No questions about it. So anyway, everything's just kind of up in the air and turned, and everything's a mess. So that's just kind of what happened this weekend, and it was crazy. And I thought I had cancer again, and that freaking scared the crap out of me. But I'm very thankful that it is just the weird spine thing. And I swear to God, if something weird's going to happen, it's going to happen to me. I just want something to go normal for once. So, and I don't think it's in the cards, but I would love for something just to go smoothly, like everybody else. You get pregnant, you have a baby, life is good. So we'll see. But I do know after I have the baby, I will have to have a spinal surgery. And that's kind of scaring me because I haven't got to talk to anybody about it, about how complicated the surgery is, how long will the surgery take, how long will I be down for, will I pop the baby out and then go right into surgery? I don't know anything. I think I can probably wait a little while to have the surgery as long as I'm not having any symptoms. So we just don't know, or I just don't know anything. But that is my crazy weekend and what's going on with us and baby, and everything has changed. So if anybody has had any experiences with high-risk pregnancy or any kind of weird crap happening to them while they're pregnant, leave a comment below. And thanks for watching. Please subscribe. Thank you.